inclusion in local and national infrastructure planning. Today, I'm pleased to welcome from the Disability Federation, Laura Callaghan, Community Development Officer, and Emer Begley, Director of Advocacy, and from the Irish Wheelchair Association, John Carty, National Advocacy Manager, John Fulham, Public Engagement Manager, and Rosaline Lally, National Access Programme Manager. So I would say to the witnesses, you are reminded of the long-standing parliamentary practice that you should not criticise or make charges against any person or entity by name or in such a way as to make him or it identifiable or otherwise engage in speech that might be regarded as damaging to the good name of the person or entity. Therefore, if your statements are potentially defamatory in relation to an identifiable person or entity, you will be directed to discontinue your remarks, and it is imperative that you comply with any such direction. I would remind members that they will be afforded a 6-minute speaking slot for questions and answers, with a second chance to contribute if they so wish. So at this stage now, I invite our stakeholders to make their opening statements, and from the Disability Federation of Ireland, we'll start with, and we have Laura Callaghan and Emer Begley. I think you're both speaking. Thank you.
Thank you, Caoirleach, and members of the committee for the invitation to appear today. As mentioned, I'm Director of Advocacy in the Disability Federation of Ireland, and I'm joined by Laura O'Callaghan, who's an experienced Community Development Officer, currently working in partnership with Wicklow County Council, and I'll share my speaking time with Laura. We welcome the attention of the Committee to Disability, noting the synergy between this work and the State's commitments under the National Human Rights Strategy for Disabled People to ensure that infrastructure, services and facilities are accessible. DFI is a civil society and pan-disability federation of over 100 members. We work at national, regional and local level to support implementation of the United Nations Convention on the Rights of People with Disabilities. We have worked with disabled people and a range of stakeholders across the community, including those in local authorities, local development companies and public participation networks to support greater inclusion and accessibility. In addition, we undertake data and policy analysis on disability issues of significance to our members. Drawing on these experiences, our presentation will focus on 3 specific areas of relevance to the work of the committee: the context of disability and disabling conditions in Ireland, towards equity and inclusion, looking at national and international obligations, structured approaches to disability inclusion within local authorities in realising national infrastructure plans and projects, touching on universal design and meaningful consultation. We wanted to start by giving a snapshot of the national picture. In the last census, just under 1.2 million people, or 22% of the population, reported having a long-lasting condition or difficulty or disability to any extent in the country. This included 8% of people who have a disability to a great extent and 14% of people who have a disability to some extent. The census data shows that the most common type of long-lasting condition reported was difficulty with pain, breathing and other chronic illnesses. This was followed by difficulty with basic physical activities such as walking, climbing stairs, reaching, lifting or carrying, experienced by 31.5% of all disabled people, followed by blindness or visual impairment, experienced by 26.7% of disabled people. These figures are relevant as the rights of disabled people to live in dignity and to participate in everyday life is enshrined in law, both nationally and internationally, through the Disability Act and with public sector duty within the Irish Human Rights and Equality Commission Act, and more recently through the European Accessibility Act, which came into effect in June last year. Internationally, Article 9 of the UN Convention on the Rights of People with Disability, a convention we ratified in 2018, states that for disabled people to live independently and fully participate in all aspects of life, they need accessible transportation, infrastructure, information, communication technologies, access to the built environment and to public facilities and services. From census data, we see that this is not a reality in Ireland, with more than half of disabled people who report a disability to a great extent also have difficulty accessing public transport, for instance. This issue was further noted by the UN Committee on the CRPD last year in their list of issues published for the Irish Government, where they have identified a gap in relation to how Ireland addresses the lack of accessible and affordable public transport and paratransit services and infrastructure, in particular for persons with disability in rural areas. A major step in meeting Ireland's obligations under the UN CRPD is through the Irish National Human Rights Strategy for Disabled People. Crucially, this is a whole-of-government framework committing to mainstream first and to remove barriers which impact inclusion. My colleague Laura will explain now how this relates to the work of local authorities.
Thanks, Emer. So there is acknowledgement in the National Development Plan that while it is guided and coordinated at a national or regional level, it must be delivered at a local and sectoral level. The central role of local authorities in the implementation of the plan is stated throughout. They are key to the delivery of housing, the realisation of climate action targets, and the administration of urban and rural regeneration schemes and community enhancement programmes. To ensure and deliver equity for disabled people to be fully considered and included in these key areas of development, structured and uniform approaches to disability inclusion at local authority level are required. In 2024, DFI commissioned independent research to investigate how local authorities are meeting their obligations under the UN CRPD. We found that despite several examples of good practice, some of which members will recognise from their own constituencies, there is a lack of consistency across local authority areas. While the Disability Act 2005 includes the provision of access officers for local authorities, the research found that these roles were not at a senior level and were being carried out without any formal training in disability or accessibility. A significant number of access officers stated that their role is an add-on to their full-time positions, often without a defined job description which they felt limited their effectiveness. In addition, disability is not routinely represented at local community development committees, LCDCs, and there's no dedicated budget for accessibility projects unless approved through discretionary funds. There's also a lack of clear reporting mechanisms to assess how well local authorities are implementing the UN CRPD in the public sector duty. And crucially, stakeholder engagement and mechanisms for consultation with local disabled people are inconsistent and under-resourced. Effective models of representation which exist within local authority structures, such as the age-friendly programme, climate action teams, local area integration teams, are not replicated for disability inclusion. There is a concern that this oversight could lead to a lack of adequate consideration for disability inclusion and accessibility in county development plans, which will in turn impact on the successful implementation of key infrastructure projects. Commitment 12 of the new National Human Rights Strategy for Disabled People commits to auditing the current status of disability-related matters across local authorities, to coordinating commitments under the strategy across local authorities, creating mechanisms for sharing best practice, and for ensuring that there is a full-time access officer in each local authority. There is an urgency for these commitments to be delivered with clear and robust targets and mechanisms for monitoring and reporting on progress. To maximise the impact of the work of local access officers, they also need to be guided by the lived experience of local disabled people, and for mechanisms of stakeholder engagement to be consistent and resourced across all local authorities. Access officers will only be effective if they have sufficient authority to contribute to strategic planning, ensuring that key documents such as the County Development Plan, the Local Economic Community Plan, which guide action and resource allocation, are disability proofed. Working towards a mainstream first approach requires the application of universal design principles, and for these to be an integral part of the design, procurement and delivery of all services. The UN Committee on the CRPD, in their list of issues for Ireland relating to the Convention's implementation, includes a query in how the principles of universal design are embedded across functions of public bodies with regard to obligations under the public sector equality and human rights duty, and to ensure public bodies deliver and procure public services and infrastructure in line with Convention accessibility obligations. Key staff therefore require greater opportunities for resource training to ensure a working knowledge of universal design. This is particularly important in planning, housing and engineering departments, and embedded in the work of local authorities. When accessibility isn't written into tender requirements, contractors can prioritise speed and cost, and access becomes an afterthought, if it's considered at all. This can result in blocked footpaths, unusable temporary surfaces, inaccessible bus stops, or confusing wayfinding that disproportionately impacts people with mobility, vision, hearing or cognitive impairments. Public procurement processes need to make accessibility a non-negotiable part of delivery, where applicants provide details of how they intend to adhere to legal obligations for the provision and maintenance of accessibility throughout works. Similarly, infrastructure projects which require temporary outages of power, water or connectivity must ensure that timely communication in accessible formats with local disabled people is a priority. No disabled person should fear unexpected or long periods of being unable to charge necessary aids or devices, access water, or use the smart technology that they rely on for their independence. Instead, key infrastructure projects outlined in the National Development Plan, if delivered with universal design and accessibility as a priority, can offer an unprecedented opportunity to radically and positively transform the lives of disabled people. Enhanced high-quality broadband, for example, also enhances opportunities for disabled people to access flexible employment opportunities, to participate in more inclusive education, and to use smart technology to aid their independence. In conclusion, embedding universal design and accessibility is not only essential to protect the rights of disabled people and to meet Ireland's national and international commitments. If embraced, major infrastructure investment can move beyond compliance and become a powerful driver of inclusion, equality, and improved quality of life for disabled people.
Thank you very much for that. And now we'll get the opening statement on this occasion. I think John Fulham is the first speaker on behalf of the Irish Wheelchair Association and other organisations. Thank you, John.
Thank you, Cathaoirleach, and members of the committee, and thank you for the invitation to contribute to this discussion on the delivery of the National Development Plan. I'm joined here by my colleague Joan Carthy, our National Advocacy Manager, and Roisin Lally, who's our National Access Programme Manager. And we're speaking on behalf of Irish Wheelchair Association, whose members live daily with the consequences of an infrastructure that too often excludes them. Ireland is living with the legacy of a society that was designed without people with disabilities in mind, physically, socially, and attitudinally. While progress has been made, much of our infrastructure continues to disable people rather than enable their participation. The National Development Plan is therefore just not an investment programme. It is a test of whether we are prepared to correct that legacy. Ireland ratified the United Nations Convention on the Rights of Persons with Disabilities in 2018. So this creates a binding obligation to ensure that the public investment in transport, housing and the built environment actively advances accessibility, independent living and personal mobility. The National Development Plan is a critical mechanism for delivering on this obligation. The scale of the plan is unprecedented, over 275 billion, with transport and housing identified as foundational to economic and social development. These are also the foundations of independent living and participation for people with disabilities. However, when we examine the plan through the UN CRPD lens, a significant gap emerges. While it funds the right sectors, it does not consistently commit to the right outcomes. Accessibility is not embedded as a core requirement, measured outcome, or an enforceable standard. Transport is a clear example. The plan allocates over 22 billion to transport infrastructure, public transport and active travel. Yet accessibility is not explicitly named as a design requirement. There is no commitment to step-free access, accessible stations, safe and inclusive active travel infrastructure, or end-to-end journeys. Transport continues to be framed primarily through climate and competitiveness rather than as a mobility right, despite transport being central to access to work, education, healthcare and community life for people with disabilities. IWA's Getting Nowhere report highlights the consequences of this approach. Despite at least 12 government policies guiding transport infrastructure, the Department of Transport and the National Transport Authority operate without a single legally binding national accessibility standard. The policy vacuum creates an inaccessible station, unsafe bus islands, and active travel designs that 77% of our members report feeling unsafe to use. The accessibility divide is stark. In urban areas, wheelchair users face broken lifts, cluttered footpaths, and inaccessible buses. In rural areas, the issue is more fundamental, the absence of services altogether. Without accessible transport, independence is impossible. Our recommendations are clear: to introduce mandatory legally binding national accessibility standards for all transport and active travel infrastructure, to ensure that people with disabilities lead policy design and governance, not consulted after decisions have been made. Embed accessibility at every stage of delivery, including the disability impact assessments and post-construction audits. Reform active travel policy to ensure safety for wheelchair users, people with mobility impairments and people with vision impairments. We are not asking for additional spending. We are asking that the existing investment delivers infrastructure that works for everybody. Infrastructure is critical, so it must be accessible. The National Development Plan must be a tool for inclusion, not a mechanism that reproduces exclusion at scale. I will hand over to my colleague Joan Carthy, who will talk to you about housing and accessibility under National Development Plan and what its current design choices mean for independent living.
Thank you for the opportunity to address the committee today. The National Development Plan rightly prioritises housing delivery, committing to an annual average of 12,000 new social homes and introducing standardised